Hi, you guys. Welcome back for our daily practice questions. It is day 176 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit that subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. All right, question number one. A 28-year-old male with chronic low back pain that improves with exercise and noted sacroiliac joint inflammation. What is the first line treatment? Is it A, methotrexate? Is it B, TNF? I don't know why that jacks me up every time. TNF alpha inhibitors. Is it C, NSAIDs and physical therapy? Or is it D, systemic corticosteroids? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the first line treatment? I tell you, if they're asking for treatment, look and see if they provided you with the diagnosis. And since they have not, we got to run it back a step further and look at the assessment findings. So this 28-year-old male comes in with chronic low back pain. It improves with exercise, and there's noted sacroiliac joint inflammation. That sacroiliac joint inflammation is a key identifier for ankylosing spondylitis, right? So the first line therapy and how you would treat that is C, with NSAIDs and physical therapy. Question number two, a 52-year-old presents with low back pain, saddle anesthesia, urinary retention, and bilateral lower extremity weakness. What is the best next step? Is it A, NSAIDs and rest? Is it B, referral to physical therapy? Is it C, a referral for immediate MRI and neurosurgical consult? Or is it D, oral corticosteroids? Take a moment and tell me what you got. All right, stem of the question, what is the best next step? All right, no diagnosis provided here either. So let's walk through the assessment findings. We have a 52-year-old who presents with low back pain, saddle anesthesia, and this right here should stop you, and also that bilateral lower extremity weakness and urinary retention, right? So low back pain. When we think about low back pain, things that we commonly are looking at is ankylosing spondylitis versus cauda-equina syndrome, right? So we just saw on the last one with ankylosing spondylitis, they can have that lower back pain and stiffness, um, and sacroiliac joint inflammation, right? But the key identifier with cauda-equina syndrome is that saddle anesthesia, that urinary potential urinary retention, bilateral lower extremity weakness, and this is why this is emergent, right? So you want to see refer them out for an immediate MRI and neurosurgical consult, okay? Because the way this is compressing, it can cause paralysis, incontinence. Um, so it's a more emergent and severe case than the ankylosing spondylitis. Pay attention to the key identifiers, okay? And then question number three, a patient with ankylosing spondylitis continues to have active disease on NSAIDs. What is the next best step? Is it A, to add a low-dose prednisone, B, start your TNF alpha inhibitor therapy, C, refer for spinal surgery, or D, add methotrexate? Take a moment and tell me what you got. All right, stem of the question, what is the next best step? Look, our diagnosis here has been provided, and it's ankylosing spondylitis. We have done the NSAIDs, but they continue to have active issues. So your best answer is B. You start your TNF alpha inhibitors, which are your biologics, right? So with ankylosing spondylitis, If the NSAIDs and more conservative route doesn't work, we bump up and go with a biologic. And this in this scenario works better than your methotrexate and your DMARDs. Okay. All right, you guys. As always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And my website is also linked in the description of this video. And it provides all the resources that I do offer for first time test takers and for those who are retesting. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.